Hi everyone, welcome back to another edition of Moments with Lulu. If you are new to my channel, thank you so much for coming back to watch my videos. And as you all can see, we're almost getting to 1K subscribers. Thank you so much for your support throughout my YouTube journey, because without you all, it would not have been possible. You all made this journey really smooth and, really worthy. Thank you so much. And for those of you who have met through my comment section, and your comments give me life to continue making videos, and thank you so much. I really do appreciate. So today's video is gonna be an update on my my second to last semester of nursing school. You see, I can't even wait to be done, that I don't even know, I'm losing track of what semester I'm in. But anyways, if you have been following me, this is my 4th year of nursing, and I just finished my 1st semester, and I have one more semester to go to be done with 4th year and to be done with nursing school. So this video is just going to be an update on how this semester went, the courses I took, my leadership clinical experience, where I'm at currently, what I'm doing, the outcome of this semester, and the outcome of the project that I was involved in this semester. So without further ado, let's get right into this video. And for those of you who have been watching me, I was working on a research study in the summer of 2020. Spring of 2020 with my research partner, Monique, and my supervisor. So if you're interested in the outcome of the project, I have linked the study in the description box of this video, because the article was published on November 27th. So it was a qualitative descriptive study on how nursing students are learning to work with older people. So if you're interested in the findings and the results and whatever the outcome of that study was, please feel free to click the link in my description box and to take you right to the study. But anyways, I'm just going to start with my nurse 422, 425, and 499, which were the 3 courses I took this semester. So 422 is the healthcare ethics and law course, and 425 is my leadership clinical, so nursing practice in a focus area, which is leadership preceptorship, that's what they call it. And then there's the 499, which is my scholarly project in nursing practice. Yes, so basically that's my honors course. That was the final bit of it, and that is done and done. So anyways, 422 was full of paper writing, same as 425 and 499. And also, if you want a detailed video on my 4-year nursing curriculum, so basically all the courses that are required from nursing school, from my 1st year up all the way to my last year, which I think is a total of 127 credits in 4 years to graduate, feel free to comment that in the comment section of this video, and I'll be happy to have that video up for you all. I had a good semester in terms of education, in terms of the courses. They weren't stressful at all, but as you all know, I completed my 300 hours of clinical, or my nursing leadership clinical, on November 26th. Thank goodness it's over. 300 hours I felt was a really long time to have a clinical leadership placement, not an acute clinical, not patient care, but leadership. So basically you're just observing, you're with a mentor, you're going to meetings, you're working on a project. There's no direct patient care involved anyways. So yeah, it was a very valuable experience for me, I would say, because I found that I learned a lot of things from that, just from that process. Being with my mentor, staying in meetings, the project I worked on, I even got a valuable experience on how to use Excel very well, and learn how to read quantitative data using Excel package. And that was I put that in my resume, because that was a really good learning for me. It's something that in nursing school, no one teaches you how to use Excel, because I guess there's no need for it. You won't learn something if you don't have any need for it. But then again, I find it a valuable skill just in case for any future job or anything I want to do, personally, at a personal level. Learning how policies can change healthcare decisions and whatnot. It was very interesting to also know that you can start today to implement policies, but it could take a really long time for the policy to come to fruition. I had a really valuable experience. My mentor was at a place where, she had a lot of experience and insight, and I could learn a lot from her just by observing, watching, participating, and just being involved gave me a lot of valuable experience. And I'm so grateful that I had someone like her. I really do appreciate that she was my mentor. The time I spent with her, and despite being COVID-19 situation, you all know, the restrictions and extra workload for healthcare workers, and then taking up a student is not going to be easy in any way. And I really appreciate that she took me as a student. So basically, one student with one mentor, that's how it works. And I was very happy and I was very excited to be involved with whatever was going on. But towards the end of the semester, I felt really exhausted, which I feel like that happens. We're all human beings. Like 3 months of work is not easy, and I just feel that way sometimes when I'm getting close to the end of the semester. There's just this, oh no, I just need to get to the finish line. I'm just done. I'm tired. Like I'm exhausted. That's how I felt like towards the end. But it's over. Like it's over. 300 hours of clinical completed, coursework completed. So for my university, the last day of classes officially was December 7th, but I finished everything. My coursework, I considered my last day of class to be November 26th. And since then, I've just been working, since I don't have any schoolwork or anything drawing me back, because I already handed in my leadership paper that was due November 30th. So I've been working for the past few days, a few weeks, few nights, yes. Another thing in terms of this semester that was kind of like tiring was just the issue of being on transit for 50 to 55 minutes. So being on the bus to clinical every morning. So I have to wake up at 4:30 in order to leave the house at 6:50 to clinical. And it wasn't easy, but again, it was a straight bus for me, so it was tolerable, and I could always do something on transit. So I could study, I could write my paper, I could read someone else's paper and give feedback, I could edit my videos, I could think of video ideas and make video scripts on the video I'm going to do next for my YouTube channel. So I mean, this semester was a very productive one for me, I would say. And just having published research, Monique and I love you so much, Monique, if you're watching this video. It was very good to have like a partner who you could rely on, and you know, having different schedule and everyone coming at any point in time to take a look at the project and how far you've gone. It feels good having that one person that you can lean on, that can support you. You can support each other in whatever you're doing. And my friend Siba, just having Siba alone, oh no, was something good to me. I mean, she's a friend I need, and I'm a friend she needs, of course. So I mean, just having that one person you can always call, you can talk to, you can go to the gym with, you can, you know, chill with, and just, you know, because you're in the same experience, you're in the same nursing program, you're in the same thing. They can relate better, and you can relate better to whatever complaints or concerns they bring up to you. And just checking on each other's mental, physical, emotional health and well-being was something that really kept me going. And my research partner, Monique, I mean, we've been friends since second year, but having her for a project that could be exhausting to the brain and to someone's physical health, especially in COVID, where, you know, some things just had to change for certain people in terms of their research, their data collection and whatnot. But just having Monique and having my supervisor as well, you know, it really changes, really made things better, made things easier. And for both of us, because if she worked a lot during the summer and I had so much time, it was easier for me to hop on our paper and do as much as I could. And whenever she had time, she would hop on and do as much as she could at the time as well. So it really made the experience very dear to both of us. It wasn't stressful, it was a time well spent, and I really enjoyed every bit of it with Monique. So thank you for being my partner. Thank you for dragging me on this project, Monique, to be honest, because I don't know if I would have been in the honors program right now, or if I would have had a partner like Monique, because yeah, she dragged me on. And yeah, Monique was my friend even before the honors program, and I'm like, of course, why not? So yeah, she convinced me, and that's where we are today. The link to the article we published, the study we published, a qualitative descriptive study, it's in the description box of this video, and we published in the International Journal of Nursing Student Scholarship. So feel free to click the link and you can read the study and read the outcome, the results, yes, of the study if you want to know more about it. Yes. And what else? And again, knowing that we had like a mixture of online and in-person classes this semester wasn't really stressful. Again, my 422, which is my healthcare ethics and law course, was asynchronous. So basically, you can watch the videos at your own time. The videos are already there because it was already scheduled to be an online class, irrespective of COVID or no COVID. It was scheduled to be an online course. And Yeah, it wasn't stressful at all because they were more like group assignments where you did with your group members, and only one assignment that had to be done alone, and that was a quiz. But it really went well. Grateful for the partners I had on that assignment because having them made it worth doing, and it was really valuable. And then for my 4 to 5 leadership, that was a course that had both a clinical and a lecture component, and we had an exam. So the exam for this course, which we wrote before the leadership clinical experience itself, we did this second week of school, so that was around September 15th, which gave me a lot of, relieved some stress in my life, just knowing that I'm done with this exam, and that's the only exam I have this year of nursing school before preceptorship. Was it was calming to know, and it was good. Like, I really enjoyed every bit of that course as well. Theory, lecture, like everything was good. It was online, but it wasn't recorded. So yeah, I think 2 p.m. was the course time for that particular, for 4 to 5 for my leadership course, and it was synchronous, so everyone had to be there during the online learning and discussion lecture. But anyways, it was very good because it was only the first 2 weeks of school, and it was an everyday lecture. And yes, it was also valuable to me because I also learned a lot of things outside of nursing school, like finances as well, from that course. I feel like nursing school teaches you some life-changing skills because you're not just confined to the classroom, in the sense that you're exposed to the community, you're exposed to the hospital, like you're exposed to clinical environments where you can you meet people, and you also gain valuable experience because, again, you never know who you come in contact with. Like, every opportunity counts in nursing school, which is what I would say. And just that opportunity to have your winter break and work alongside school, or have your summer break, your fall break, and work, and also work alongside school, gives you a lot of opportunities and a lot of exposure. And having online learning this semester didn't feel it didn't feel strange. It wasn't challenging. It had its own pros and cons, but I would say the pros were more, in the sense that, like I said, I had time to do my YouTube videos. I had more time at the comfort of my home, and I wasn't someone who procrastinated. I never gave room for procrastination. I had a mentor who was also a PhD student, and it was really easy to just talking to her as well. Also helped me to focus, to know where I'm at. Just having meetings scheduled and having plans for each day before even the week is over, before that day comes, kept me on my toes because there was no room for relaxation. And again, my mentorship experience, the project I worked on, I can't really say much about it because of confidentiality purposes. The project I worked on really kept me on my toes because I really wanted to see the end result of that, and I wanted to be the one to finish it, since I started it with my mentor and her team anyways. So yeah, and this semester I would say was filled with lots of experiences, valuable experiences, and I never found myself to be at a point where I'm like, I'm just done and I can't move forward. And I didn't even have my winter break. I didn't have my fall break. Yeah, my midterm reading week. They call it reading week, 1 week break. I didn't have it. I decided to use that time to do my clinical experience and get rid of those 300 hours as quickly as I could, because I found that the more they dragged on, the more I was coming to an end. I was feeling kind of like exhausted at some point, and I didn't really want that to drag so much. So I just wanted to, have it all together, and then have my winter break and maybe an extra week of school, and just like chill and work and not think about school, and make study plans for upcoming NCLEX and upcoming semester, and practice some nursing skills, which I mean, I haven't done that yet, but I hope I'm able to do that before the middle of this month, which I mean is almost next week. And yeah, like this semester, in summary, I'll say it was a really good semester, academically, mentally, physically, spiritually, emotionally. Yeah, I would say it was even better than my first, second, third year semester. I mean, even if it was a graded semester, I really enjoyed every bit of it this semester. There was no stressor in my life, like first year. And I know what first year feels like, and I just want to put this out there. If you're a nursing student and you're watching this video, if you're in your first year, if you're in your second year, and you find yourself struggling with any course, or just struggling maybe mentally or physically, because of what nursing school can do to a person, please feel free to reach out to me. My Instagram and my Facebook, you can get it on the screen of this video, or you can get it in the comment section or the description box. Feel free to, like, message me. You just want to talk, you just want to talk. Sometimes you just want to relieve your frustration with nursing school, or there's something that's really making you so anxious or stressing you out. Please feel free to reach out to me. I would love to communicate as well, because nursing school is definitely not easy. And just knowing that I'm in my 7th semester, so my 4th year, first semester, and I'm done with this, and then having one more semester, looking back, made me realize that this was a very long journey. And it's not just about one person, it's not just about you. You need friends to survive, you need family to talk to, you need a good support system. And please don't even dwell on stressful situations by yourself. If you need someone to talk to, feel free to reach out to me. Reach out to your faculty, your friends, anyone at all, because going to nursing school is definitely not easy. It's definitely not an easy journey for a variety of factors that I don't need to mention, of which financial and social factors could be the topmost of them all. But yes, anyways, that brings me to the end of this video. Like I said, if there's any other video ideas or any other thing you're curious about nursing school, about me being in nursing school, feel free to leave that in the comment section of this video, and I'll be happy to make a video or respond to your questions as soon as I can. And I'm good at responding to your comments. So yeah, if you have any questions, video ideas, suggestions, please feel free to drop them in the comment section of this video, and I'll see you all in my next video. Bye now.